Thank you and welcome to my lunchtime clinic. Dr. Chudi reporting to lunchtime open clinic. And just about the time I'm coming live, this guy, Whiskey, is blasting all the way in Florida. So let's enjoy that a little bit. When you come in, please announce your name, announce your location. It's my lunchtime 30 minutes open clinic. So when you come in, tell me your name and where you're located, okay? And you can enjoy the music on the background. Dr. Ndiche, I can see you. Thank you for coming. It's still Dr. Chudi trying to rock today. Music. It's a feeling of good thing to have a Nigerian guy all the way in Florida taking over the waves. It's a good thing. So please, when you come in, it's still my lunchtime open clinic. We're gonna use the next 30 minutes. The next 30 minutes to provide you feedbacks. Okay? I got body. I got body. Okay, guys. Sorry about that. But hey, sometimes you just have to lead mass, okay? Sometimes you just have to lead every single thing on your shoulders and be happy. This dude, Whiskey, I can't remember any time I enter my car and I'm not hearing his music. In America, in Florida, it's a thing of joy. It's something I derive a lot of joy in. So today it's another opportunity to touch base and get some feedback. So it's my lunchtime. I'm going to spend the next 30 minutes providing you with feedback. Now, please, when you come in, make yourself comfortable. Announce your name, announce your location, focus on my admin. We have a full house. Dr. Ndiche is in the background. Kenneth is in the background. Chinyere is in the background. Onyinye is in the background. Ebenezer is in the background. So we have a full house. And after my lunch clinic, make sure you transition to our group and our page to be in Dr. Ndiche's clinic. You don't want to miss her clinic. Every single clinic she's hosting, it's changing lives. So thank you so much and welcome to another opportunity to get feedbacks to your questions. So as soon as possible, start asking your questions. I don't have a topic. It's just question and answer. So every Monday, Tuesday, and Thursdays, it's just open. But Wednesdays and Fridays and Sundays, I normally have a topic. So today is Tuesday. The major clinic today is Dr. Ndiche. So what I want you to do is to relax, invite your friends, and ask your questions, okay? All right. Thank you for coming. Make sure you announce your location. Your location is going to help me to see what we can do for you to get the best. There are a couple of places we can refer you in real time. And today we're going to have meaningful conversation. And I'm going to start with a trending topic. You see, I understand you want to have a girl, right? You've had boys. You have 4 boys. You have 5 boys. But you just want that girl. You want that girly thing, that girly feeling in your family. It's okay. There is nothing wrong in wanting to have a baby girl, right? Or probably you have boys. You have 6 boys and you want a girl. Or you have 6 girls and you want a boy. You just want to dilute your family. It's called family balancing. My people, there is absolutely nothing wrong in that. Now, growing up, I remember my 2 grandparents. They have so many kids. My paternal grandfather married 3 wives. My maternal grandfather married 2 wives. Now, in my paternal side, we are many. And the best periods are during Christmas, when everybody comes home. So having kids, a lot of them, boys, girls, is a good thing. But this is the reality. This is 2021. Whatever you want, make sure your economy can power that. So if your economy can power one kid, please have one kid. If your economy can power two kids, please have two kids. If you currently have two kids and they are girls, if you ask me personally, in my own way, I would say love on your girls, okay? But if your economy can afford to have another baby and you want to have a boy, you can have a boy. And there is nothing wrong in having a boy. The best way you can have a boy to start with is to apply the motto of a group. You can go down on your knees and you can tell God to give you a boy, and God can give you a boy. Now, besides that, God also made it possible for some professionals to aid you in having a particular gender. Okay, so you might want girls, you might want boys, you might want twins, you might want triplets, which is okay. This is the environment, this is the condition we found ourselves. What we know is the fact that God did not make anybody to be alone. So whatever you want, get the knowledge. Our duty is to provide you the knowledge. So for the month of September, we are going to devote September to what? Gender selection and family balancing the right way. There are so many rumors. There are so many things your friends told you. You can do this. You can hang your leg. You can stay in bed for 12 hours. You have a boy. You have a girl. We are going to look at all those claims. Then we are going to show you the right way to have your boys, to have your girls, to have your twins, to have your triplets. It is possible, but you need to know the right things to do so you can make informed decision, okay? So make sure you register. Follow the admin. You are better served coming with your partner. Like one of the questions I posted in my timeline, you know, a guy that it's the last boy in their kingdom. I'm Igbo, right? And I can't denounce my origin. I'm Igbo. Now in Igbo, they lay a lot of emphasis on continuity. Now the way the Igbo family is structured, if you're a boy, when you become a man, you're gonna retain your family. You're gonna retain your father's surname and begin to raise your own kids. Now, this particular guy is from a royal family, and for some reasons, they've had girls, and he's wondering what he can do to have a boy. He's a good candidate for the upcoming Super Masterclass. We are gonna make it easier for you to take your both steps. You can have your boy, you can have your girl. If your happiness, if the peace in your home is dependent on having a baby boy, a baby girl, there are so many ways you can do that. You can even go for adoption. So I'm not going to give you all the extensive details, but I'm telling you today that having a boy, having a girl, having twins, triplets, quadruplets, it's possible. Okay, so let's continue. Let's start taking care of your questions, okay? We have just about 30 minutes to provide you feedbacks. So if you haven't registered, the class is gradually filling up. We are only going to go with the people interested. So I will encourage you to register early. Okay, we are ready for you guys. And we're going to tell you what we know. Okay, let's see. Okay, your fiancé is hepatitis B positive and you are negative. Please, what's the implication if you go ahead with the marriage? Now, I'm going to tell you what I know, my sister. Hepatitis B is a highly contagious blood-borne viral infection. Unfortunately, it's not permanently cured. Hepatitis B can be prevented by taking your hepatitis B vaccine. So if your partner is currently positive, he's positive. And guess what? He's going to have this exposure. It's not permanently treated. But for you, if you are negative, what you need to do is to go and take your hepatitis B vaccine. It's completely preventable. We actually have 3 types of major hepatitis B infection. We have hepatitis A, which is fecal oral. You can contact it through the oral avenue. Then we have hepatitis B, which you can pick up just like HIV. Then we have hepatitis C. So if your partner is hepatitis B, I don't know where he's residing. What he needs to do is to see an infectious disease specialist. Now for you, you have to go for hepatitis B vaccine to start with. Now, when it comes to matrimony, the choice is yours, but you need to be informed. You need to know what you're going into. It's just like when you guys go for HIV test. Now, prior to now, we used to see HIV like death sentence, right? But guess what? You can still have your HIV, You can still live into the 80s, into the 90s if it's properly managed. Know the difference between HIV and AIDS. HIV and AIDS are not the same thing. When you have human immunodeficiency virus, that's the virus. If you do better, if you do well, and you're on your drugs, you can completely live a good life, and you will avoid getting to AIDS. AIDS is acquired immune deficiency syndrome. AIDS is the outcome of HIV when it's not properly managed. So in your own case, besides the fact that your partner is it's hepatitis B positive, you also want to know the whole package. So you want to know the genotype, you want to know the blood group, you want to know the HIV status. Okay, but what you can do acutely, immediately, without wasting time, is to go and start your hepatitis B vaccine. Thankfully, it's preventable. Hepatitis B, it's more contagious than HIV. So if you guys are going to be together, if you don't have your vaccine and you make love to your partner, the possibility you're going to pick up the hepatitis B viral infection is high. Okay, let's continue. All right, please ask all your questions. I'm going to provide you feedbacks. Dr. Ndiche is also supporting me in the background. Thank you, Doc. Now, remember, if you need to consult with me, it's possible. You just need to decide what you can afford. You can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. If you are already pregnant, you can also go for our ANC. If you want to be a mother in 2022, you can also come for our Believing for Baby Lounge. Both of them are in Telegram. Now, please listen to me carefully. When you subscribe, find time to read what you subscribe for. Find time to know your rights. Now, for women that are coming in 3 months for Classic, you have 3 opportunities to talk to me one-on-one with your partner. If you're coming in for 6 months, you have 6 opportunities to talk to me one-on-one. So you have 1 in a month opportunity for phone consult, for review. If you're in Classic and Prime, Classic is 3 months, Prime is 6 months. Now, if you're coming for 1 week, your 1 week is chat consult. We're gonna go back and forth, back and forth, back and forth. Hopefully, we're gonna figure out what's going on. Then I'm gonna refer you. Now, one standard thing, you have to be conversant with my consult. When you are coming in, I'm gonna ask you a lot of questions in my intake form. I have about 27 questions I'm gonna ask you. Those questions are gonna help me to know you better, to know your history, to know your gynecological history, to know your last menstrual period, to know your surgical history, to know your medical history, to know your blood pressure. Now, when I'm done doing that, I'm gonna ask you about baseline investigations. Your baseline investigations will require you to give me fertility assessment of the female and fertility assessment of the males. Now, you have to have this ready at least 6 months, within 6 months. When you have this, it will give you an advantage towards having a diagnosis. Because the baseline in medical practice is finding diagnosis. When we find the diagnosis, we have solved that problem by 50%. So please, it's not just enough to subscribe and you don't know what you're subscribing for, and you stay in the background and you're complaining. Find out how it works. Take time, read through, then enforce your rights. Once you get any subscription, you have the right to be listened to. You have the right to be attended to. You have the right to get feedbacks when you ask me questions. Until your subscription is expired, you have 100% right to hold me accountable. You can take it to the bank. Okay, so let's continue. All right, let's go, guys. Okay, where are the questions, please? I always feel better when I'm at home because I can see the screen bigger. But whenever I'm at work, when I'm using my break time, my screen is a little bit limited. But hopefully I'm gonna see the questions, okay? So give me 1 minute. Okay, hopefully it's gonna come up. Okay, no time for calls for now. I'm busy. Please keep asking your questions. It's open clinic. Admin, you can repost any question I haven't provided feedbacks to. Ask your questions. I don't have a topic. If you need to consult with us, please register. If you're pregnant, please register for ANC. All pregnant women are advised to register for ANC, okay? Thank you, Dr. Ndichie. I think Dr. Ndichie provided a feedback to a particular question. If you're a new mother, please make sure 18 months has elapsed before you deliver another baby. 18 months. 18. Very important. All right, guys, where are your questions, please? Ask your questions. It's open clinic. There is no topic. It's just question and answer clinic. So the more you ask questions, the more I'm going to provide you feedbacks. Okay, where are your questions, please? Please ask your questions. Please ask your questions. It's questions and answers. Ask. I'll provide you my best feedbacks in real time. You're seeing me live. If you don't have access to subscription, if you cannot afford it, this is your opportunity. Okay, let's see. How long for a mom who had CS to get pregnant? Okay, if I understand you correctly, you already have your baby, right? Your baby is doing fine. Now, when you compare CS and vaginal delivery, CS is a major surgery, okay? Anytime we put you under anesthesia and we open your body, that surgery is a major surgery. Now, when you're going for CS, you have two cuts. One on the anterior abdominal wall, one which is on your belly. When we cut that, we will cut another one in your womb. So the key word is what? Recovery. You have to recover in that physical wound. You have to recover emotionally. You have to recover psychologically. You have to recover financially. And remember, you have a baby. Okay? So your recovery is important. Now, every singular woman who delivers her baby is given an appointment, which we call preparing. When you come back for your appointment in 6 weeks, we are going to assess your baby. We are going to assess you to see how you're doing. Now, if you have CS, after your CS, you will go for post-CS appointment. We are going to check your CS wound. We are going to confirm if you are healing properly. We are going to confirm how you are adjusting to your new baby. We are going to confirm how you are getting the help. Are you getting some sleep? Do you have someone helping you? What about your emotions? Some women can develop some complications after birth. Some women can have what we call postpartum depression, postpartum psychosis, or maternal blues. They are all mental health problems. So if you're not getting help, you will be overwhelmed. Now, pregnancy is something we plan. We are not in a hurry. Before you become pregnant, plan ahead. Make sure you have enough money. Make sure you have enough resources. Make sure your partner is helping you. When you don't plan your pregnancy, you're putting your life in danger. When a woman delivers a baby, there are so many things you lose in your body. You need to recover them. So the best time to recover when you've had a baby is what? 18 months. 18. Now, in some situations, depending on your age, depending on your ovarian reserve, depending on the chances, we might not wait up to 18 months, but you still need to get a clean bill from your provider. Let me give you an example. You are 45. You had your first baby at 46. Definitely, we're not going to allow you to reach 18 months. What we're going to do, we are going to monitor your delivery. We are going to monitor your recovery. We are going to monitor every other indices. Then as soon as possible, we encourage you to go for another one. Now, the possibility that at 46, you will have your baby naturally, it's not completely impossible. It's possible, but it's reduced. Now, the best chance for you to have another baby at 47 is to go for assisted reproductive technique. And when you're going, you'll be open to use donor egg. So listen to me, every woman in this community, listen to me carefully now. If you don't have a baby now, as I'm talking to you, and you have entered 40, 40 is a good place to be. When you get to 40, you have conquered life. Life is good at 40. Now, what you need to do at 40 is to deal with your reality. Later this evening, I'm going to talk about spirituality, spiritualizing your infertility, blaming the people in the villages, blaming the demons, blaming the devil, and you're not doing anything about it. We are going to look at the impact of over-spiritualization or spiritualism or whatever you call it in regards to having a baby. So many people are not able to have their babies today because they have blamed everything to evil spirit, because they are waiting for Jesus Christ of Obunike. Meanwhile, the Jesus Christ is living in you. So we're going to go there. Okay? Now, for you to get pregnant and how soon you can become pregnant is dependent on your age. The older you are, the more the likelihood you want to get pregnant as soon as possible. But we want to make sure that you're not going to be in danger, because becoming pregnant can be complicated, especially when you're older. Okay, so let's continue. Please, when you come in, continue asking your questions. Dr. Ndiche is helping me. Okay, let's see. Doc, thanks. Can a first-time CS mom have a normal delivery? I'm also going to use this to correct you, my sister. You see, in our group, we are careful what we say. We don't just go saying things we don't understand. Now, there is nothing abnormal about your CS. Vaginal delivery and CS are both normal delivery. The word you should use is natural delivery. Vaginal delivery is natural, normal delivery. CS is emergency, normal delivery. So there is nothing abnormal about CS. So please be careful. So many women have really put themselves in danger because of the attitude, because of their practices, because of the way they follow CS. If we don't have complications in pregnancy, we will not have CS. Imagine our grandparents when they had no doctors and they had a need for CS. So many of them died. So many of them died during delivery. So many of them that had twins were abandoned in the evil forest. Now, this is life. Imagine if you were born in the 40s in Nigeria, in Igbo land, and you're gonna have twins. Guess where you will end up? Evil forest. There was a time that twins are seen as taboo. Now everybody wants to have twins. Now, my sister, your CS is completely as normal as possible. Admin, capture this for me, please. Vaginal delivery and CS delivery are both normal delivery. The normal wood to use is vaginal delivery is natural birth. CS delivery is emergency birth, interventional birth. When you have a need for CS, it means you cannot have your baby vaginally. When you want to have your baby vaginally, your baby can die or you can die or both of you can die. That's why we have CS. Now, some women can have CS ahead on time. We can tell you ahead on time you're having CS. It's called elective CS. Some women will be getting ready to go for vaginal delivery and they might end up needing what we call emergency CS. Elective CS is much better than emergency CS because in elective CS, we're just going to give you a date. You can even choose your date and we open you up and bring out your baby, so long as your baby is good to go. Now, some women can have what we call VBAC, vaginal birth after CS. So the fact you had CS doesn't mean you can't have vaginal delivery. If you qualify to have vaginal delivery, you can have vaginal delivery. But this is what we know. Most women that had CS will continuously have CS for all their pregnancies. It's safer for you to have another CS than to go for vaginal delivery. You might have a lot of complications, but some women can still have vaginal birth after CS. So who will decide? Your doctor and your baby. There are some medical conditions that will warrant us to deliver your baby ahead on time. So the growth of your baby, the progress and complications in that pregnancy, and the decision of your doctor will be the best. The ultimate aim of a good doctor delivering a mother is to have the mother alive so that the mother can see the baby, is to have the baby alive so that the baby can see the mother, is to have the husband around so that the husband can see the mother and the new baby, so that the siblings can see their siblings. A pregnancy is not considered done until we have delivered the placenta. Unfortunately, so many women are insisting on delivering back like the Hebrew women. Meanwhile, there is no such thing in reality. Your delivery method is based on what it's gonna work for you and your baby. So don't even delay for 1 second. We've had so many women that died. We've had so many women that bled to death because they refused to go for CS. By the time they gave up ghost, it was already late. There is nothing wrong in having a baby through CS. It's okay. All right? Okay, let's continue. Okay, let's see. Okay, I'm gonna put that question on the screen now. Okay, let's go again. Okay. Doc, you just had your embryo transfer yesterday with 8 cells at 38. Do you still have a chance of twin implantation? Why not? Why not? But guess what? The number of embryo they transferred is going to determine if you're going to have multiple pregnancy. So if I understand correctly, you said you got 8 cells. So do you mean 8 embryos? Nobody will transfer 8 embryos. So it's possible maybe they got 8 embryos, they transferred 2, and they kept the other 6. You can have multiple pregnancy. Now, your multiple pregnancy is going to be dependent on 2 factors. We can transfer 1 embryo and it can divide and have identical twins. Or we can transfer 2 embryo and 2 of them will survive. So that's how you can have twins. So it's possible. Now, you did the right thing. You are 38. You are doing the right thing by going for IVF. You are not taking chances. So once you get to 35, you begin to take all your chances. If you need to go for IUI, go. If you need to go for IVF, go. If you need to go for surrogacy, go. If you need to go for donor egg, donor sperm, go. If you need to adopt, adopt. This is the right way to act if you want to be a mother in 2022. So let me tell you my prayers for you. By this time, September 7th, 2022, you will have the cries of baby in your home. You will show up in this group to testify about the goodness of God in this group. You will have your babies in your hand for taking the bold step of going against all odds and going through the pains of injections and going through the pains of rejection. And you yielded, and you and your partner saw it needful, had the need to go and source for millions. And for going for this IVF, God is going to bless you. God will give you what you want. God will give you your boys. God will give you your girls. This is the end of infertility in this home. And it's going to be like this. And you're going to come back and you're going to testify about the goodness of God. Now you are 38. You're going to have your baby at 39. When you have your baby at 39, around 40, we are going to assess you. Then you can go again. Now, if God bless this particular journey and you have your twins at 38, you can have another IVF and you can have another twins, and that's 4 babies. It has happened before. Nothing is impossible. So for you to have taken this bold step, God is going to bless your efforts. Okay? It's going to happen. And it's going to happen. Okay, guys? I have about 3 more minutes or thereabout. Let's see. Good evening, Doc. You overheard me saying something about HIV. And you just came in, but you didn't get me clearly. HIV is one of the tests we check among couples before they marry. And I told you guys that HIV is in the same category with HPV. Hepatitis B virus is a blood-borne viral infection, which is actually highly contagious compared to HIV. You can pick it up through sexual contact or any exchange of blood. Now, unfortunately, when you have hepatitis B, you are going to manage it for life. When you don't have hepatitis B, you can go for hepatitis B vaccine. Thank God we have a vaccine for hepatitis B. When you take the vaccine, you can protect yourself from picking hepatitis B. Now, I also told you that if you have HIV, it's not a death sentence. You just happen to have human immunodeficiency virus. But when you are not properly attended to, you can graduate from HIV to AIDS. AIDS means acquired immune deficiency syndrome. HIV means human immunodeficiency virus. When you have HIV, it doesn't mean you have AIDS. You can have HIV and you can spend 20, 30, 40 years. If you guys are conversant with Magic Johnson, a renowned basketball player, for going to 30 years now, this guy has been living with HIV and is doing just fine. So gone are the days when they tell you you have HIV and you kill yourself or you lose hope. You can still live a normal life if you have HIV. You can still marry the love of your life. Both of you can still have babies that will not be HIV positive. So the fact you are HIV positive doesn't make you different from anybody. Now, if you don't know better and you begin to go and stigmatize about people that have HIV, you suck as a human being. That doesn't make sense. They happen to have a virus, so you don't judge them. So having HIV or HPV doesn't stop you. What you need to do is to come to table of equity by telling your partner exactly your status. So if you guys decide to go ahead, then you're doing it with informed consent. Okay, guys, I think my clinic is done, but let me answer one more question. Then please quickly hurry and join Dr. Ndiche's clinic. Okay? Guys, I'm a believer of God. I'm a God's child. I'm a Christian. I believe in praying. But what I've noticed in our group, so many people pray, but they don't act. So many people say amen, but you don't know the meaning of amen. Amen means you are in agreement with me and you are going for concrete steps and you are taking actions. My people, today is the 7th of September. We don't have time. If you want to be a mother in 2022, take your actions today. You can end your infertility in 2021. You will not carry it over to 2022. If you are not doing the right things, start doing the right things today. Okay, so let me provide feedbacks to just one more question, okay? All right. Is it normal for your middle finger to reach your cervix? You feel it blocking the sperm? My sister, why are you messing about? Why are you messing about? Why are we creating storm in a teacup? Why are you hurting yourself emotionally and psychologically? You see, you are not the doctor. When you begin to think you have a problem, psychologically, your body will start reacting as if you have a problem. Whether you're putting your middle finger, whether you're putting your long finger inside your vagina and you're getting to the cervix and you're beginning to give yourself diagnoses you don't have, you are hurting yourself. Stop right now. Go and see your gynecologist. So many of us are leaning on our understanding. You don't understand and you are not seeking the higher knowledge. You want to be a doctor, you want to be a professor, you want to be everything, and you don't understand. And at the end of the day, you're making things worse. You are not supposed to be experimenting with your body. You are not supposed to be giving yourself a diagnosis you don't have. Go and see your doctor, my sister. What's your name? Fortune or Sadalo? You are a Nigerian. You should know better, my sister. In this group, my duty is to show you the way. If you're in this group, you are blessed. We need to know better. Some of us have done the right things from a place of ignorance. You cannot be in this light and you don't know. You can't sit back and you are assuming. We have assumed we have malaria, we have typhoid, we go and start taking drugs. We have assumed that we need chlomine. You go and be abusing chlomid. You have abused, you need Postinol. You go and be abusing Postinol. Now you are now putting your finger in your vagina, getting to the cervix, and you're giving yourself a diagnosis you don't even have. It doesn't make sense. Simply go and see a gynecologist. Let them do their job. Please. Thank you for coming. Keep a day with me this evening. We are going to talk about spiritualization of your infertility. When you begin to look for Amadioha in your village, when you begin to look for your village people to blame for your infertility, meanwhile, the reason why you don't have a baby is because you're not making love to your partner. When you begin to live in church and the money you need to use for your fertility treatment, you are dashing it to a gullible pastor. You are the one shooting yourself in your leg. Come, let's show you the way. So join my clinic later today. It's going to be in YouTube. We are going to help you to know better. You are in the light. If you're a member of this group, you will not say you don't know. Thank you for coming. I love you guys. Please proceed to Dr. Ndiche's clinic in the next about 45 minutes, okay? Or less than that. I think in 25 minutes. Thank you and God bless you, and I'll see you tomorrow. Bye-bye for now.